Hello everyone, thank you very much for joining us today. This is Medigold Health's first Absentia webinar. We've had a great uptake, so we thank you for registering and we intend for this webinar to be one of many to come. A little bit of housekeeping first. So we do welcome questions throughout this webinar. There is a Q&A functionality at the bottom of your screen. So if you'd like to submit any questions, please do. There's some wonderful people working in the background to bring these to our attention at the end. And we'll try to answer as many as possible. But obviously, if we can't get around to answering all of these, what we'll do is we'll send out an FAQ sheet shortly following the webinar. Next slide, please. So we'll start with some introductions. My name is April Cremins. I'm an absence management and occupational health consultant here at Medigold Health. I'll hand over to Chantal.
Thanks, April. Hi, everyone. I'm Chantal McDonald, and I'm the director of the Absentia product.
Hi, everyone. My name is Lisa Warren, and I am the Absentia account manager here at Medigold Health.
Hi, everyone. I'm Diane Smith. I'm the associate director of nursing at Medigold.
And we are also lucky enough to be joined today by Andrea, who has been using Medigold Health's absence management service since February 2019.
Hi everyone, I'd just like to say thank you to Medigold for inviting me along today.
Thanks. Next slide, please. So moving on to the topic of today's webinar, cracking the COVID absence conundrum. I don't think there's a better way to sum up the last year. The impact of COVID has seen a number of challenging factors, obviously the pandemic itself, furlough, redundancies, presenteeism, burnout, and in some way or another, it's affected almost every industry. Absence isn't always something that's spoken about willingly either. We know as corporate entities, we can tend to be quite guarded when it comes to absence and the challenges that it brings with it. And with COVID adding to that pressure, hopefully today's webinar will bring to surface some of the experiences and pressures that COVID has imposed on those here today. And working within healthcare, COVID has been particularly challenging, so we thought it would be really useful to have Andrea on the call to share some insight on how her organisation has managed during this period as well. Next slide, please. So to start off, this question is directed to either Lisa or Chantal, as you work closely with our clients. What were some of the challenges that clients were sharing with you at the start of the pandemic?
So I think the biggest and most obvious challenge for all businesses when it comes to COVID absence is the mandatory isolation period that we've all got to adhere to. But with COVID, it's not been just as straightforward as people being off with COVID, confirmed absences or even COVID related symptoms. There's all the associated absences that have come along with that, such as travel isolation after returning from holiday, track and trace isolation, and also people shielding because they're vulnerable or high risk. So some of these, as you can hear, are not actually to do with illness or sickness. It's actually a non-medical absence that's actually then happened because of the COVID situation we're finding ourselves in.
And I think what we've seen actually is, fortunately, some of our businesses that we work with have been able to introduce flexible working and working from home. So when we are looking at potentially non-medical absences where employees actually aren't unwell, they've been able to support them with working from home. But for some of our other organisations we work with, this hasn't been possible. And what we've seen from that is that the absence has increased quite significantly. And this is clearly evident in a number of calls that we've been receiving, but also when we're starting to look back at their data. So for all COVID absence related absences, we have also helped the business to manage the onward impact of managing those absences. So looking at informing the right teams internally to pick up any processes and just to help identify and manage any potential spread of infection that they could have in the workplace.
I think another challenge that everyone's been facing is in terms of when somebody is off with a COVID related absence, the guidance that they should be following in line with that absence reason, because particularly with the government changing their guidelines quite regularly with the more data and the more information they've been receiving, this in turn has meant that when somebody is off absent, we need to at that point in time and throughout that period of absence be updating them and making sure that they've got the most up-to-date information at that point. Next slide, please.
So what advice or support did we give to our clients to relieve some of this pressure?
I think with all types of absence, it's important that we're classifying it and recording it correctly. But this has been key with COVID. So it's important for us to ensure that we're asking the right questions and classifying the absence correctly. So if someone was calling in potentially with flu-like symptoms and a cough, to make sure that we're identifying correctly any potential COVID cases. How this has worked with some clients that are using our Absentia service is we introduce new classification reasons, absence reasons, into the system to be able to record both medical and non-medical absences during this period. We do review these quite regularly, and as soon as a new type of classification becomes apparent, we will put that into the system to be able to help report on that also. So, for example, the most latest reason that we've added into the system was for long COVID.
And I think with having the new absence reasons integrated into our system, what it's allowed us to do is have pop-ups for our call advisors. So at the point that somebody's logging an absence reason for a particular COVID situation, would have the relevant guidelines popping up. So at that point in time, the call advisor is able to advise the employee of the most up-to-date information. And it's something that we review regularly to make sure that that is always the most up-to-date information for that person.
Yeah, and I think communication is important with any absence type, but given the past year with the pandemic and isolation, what we've continually done is encourage our managers to interact with their employees when they're off work, be it that they are unwell or that they can't attend the workplace, is to keep that communication there, check in on their well-being, have conversations around any additional support that may be available to them that the organisation has access to. So things like employee assistance programs. And also some of our clients have asked that the COVID absence reasons that we've put in the system are actually set up as trigger types. So what that means via the Absentia service is that as soon as someone hits the trigger, that employee is getting our occupational health nurse will be giving them a call and is then offering and able to support them and give them advice from the very first day that they're off, but also as an interim almost be able to signpost them as well to any additional benefits that may be relevant for their absence.
The other thing that's been really important for everyone to do is in terms of tracking COVID absences, obviously to manage the spread of the infection. So one of the things that we've tried to work with each and every one of our clients is to actually understand how we can give them that information at the best point in time. So for some of our clients, as Lisa just said, we set up COVID triggers, and what that's meant is that as soon as somebody logs a COVID related absence, we can send out a notification, not just to their managers, but also to a relevant team or management team, that they can immediately act upon that COVID absence at that point in time. For other organisations, what they've asked us to do is set up regular COVID reports. So any COVID related absence would come across in the report in whatever format, with whatever criteria they require it in. And that can be as regular as an hourly report. Some of them are daily, some of them are weekly. So we've just tried to make sure that everybody has the information that they need in terms to manage them with their internal policies and processes. Next slide.
Lisa, we've mentioned the medical aspect of COVID and reporting on it, but where businesses were forced to adapt to things like working from home or furlough, what kind of support have we offered here?
So I think, as I mentioned before, businesses have had to adapt quite quickly to the way that they've been working and to support the current situation that we've now found ourselves in. So for some of our clients, where they've had to adapt from working from home, others haven't been able potentially to have that option, and they've had to look at things like furlough and in some cases redundancy. So for our clients that have had employees working from home, they have asked us to be able to support them in recording that also. So in terms of symptoms, so they can manage the COVID spread within their organisation. Because working from home isn't really an absence, necessarily reporting an absence because they are still working, what we did do was create an online form to allow employees to be able to log on, complete the form, stating that they're symptomatic or they're isolating for whatever reason, for us to be able to record that internally. So what that meant for our clients is that at a glance, using their absence data, they can look at the potential impact that COVID's got on the wider business, be it people working from home or people that are actually within the organisation. What they've also allowed us to do, so we have, as Shan mentioned, set up COVID reports. We are obviously allowing us to be able to send out initial notifications as soon as we log that non-medical COVID absence reason, but also be able to report on the non-medical aspect side. and equally exclude it from our sickness absence reporting.
And I think with all of the changes that businesses have had to make, it's obviously had an impact because it's changed on both employees and managers, and it has had an impact on their mental health, which we've seen across the board for all businesses, no matter what type of business everyone is running. So it's something that actually we've really had to try and support with, and it's going to be an ongoing issue for a while yet to make sure that we're supporting people with it. So I just wanted to raise a couple of things that we have done with some of our clients in case it's of interest for other people. So we have, as Lisa has mentioned earlier, we've got the early intervention piece. So when people are phoning into the Absentia service, if it does hit one of our predetermined triggers, of which a psychological absence or mental health absence is one of them, they will get a call back from one of our occupational health nurses to give them advice and guidance from that very first day that they actually are off absent, and to make them aware of different services and benefits they have available to them and signpost them at that point in time. And after having had that conversation with the employee, being able to come back to management as well if there's any recommendations that the business can do to support them. We also have within the system itself, if somebody does phone in with a psychological absence, a pop-up. So if the company does have an EAP service, at that point in time that somebody's phoning in to log that type of absence, we can remind them that actually they have access to a confidential counselling service and provide them with a telephone number there and then, because often it's something that people just forget they have access to. We have done some other things as well. Our partners at Thrive have been running some online webinars which have been free and have been ranging a whole world of different mental health issues. And if you haven't had a chance to view any of those, they are available online and they are relevant for both managers and employees. So there's quite a lot of different webinars available for free of charge online now. And also we have had some workshops that we've worked in line with some of our clients' HR teams. We've worked in partnership even to run Q&A sessions, and this has been attended by both employees and managers, and what that's allowed them to do is to come forward with any questions that they wanted to ask, and from a clinical perspective we've been able to support with that, which has been particularly helpful in terms of shielding employees, particularly at the point of where they're coming back into work, and addressing that fear, because it is a worrying time if you have been absent for such a long period.
Absolutely. And Diane, this is more a question for you really. With those individuals that are shielding, what have we done to ease them back into the workplace?
Well, as we're all aware, the historic on-off shielding requirements have placed a challenge on the mental well-being of the, so to say, extremely vulnerable employees. That being said, and they've been advised that they may now return to work in the current presence of COVID-19, although to a lesser degree present in the wider population, is challenging on their mental well-being. We found that a number of the employees we've spoken to are finding it difficult to accept a degree of risk of being exposed to COVID, in as much as businesses have worked tirelessly to mitigate their risks by ensuring that social distancing, the provision of masks and sanitizers, the resistance or hesitation to returning to the office remains present for many. Some creative adjustments and support is required to assist in achieving a successful and sustained return to work for everyone. Some suggested adjustments businesses could look to accommodating would be to afford time off to attend ongoing medical appointments for those that have experienced COVID through this time, the provision of EAP counselling services for early intervention. A further suggestion is look to on-site mental health first aiders to assist where people run into challenges with their mental well-being. And looking at the HSC, look to undertaking stress risk assessments in conjunction with the concerned employee. So developing an agreed support plan for each employee who is facing mental health challenges, and then use this document to guide your expectations and to further negate any unrealistic expectations.
Thanks, Diane. Next slide, please. And Diane, you just mentioned the importance of mental well-being. According to the CIPD Health and Wellbeing Report of 2020, mental health or mental ill health remains the most common cause of long-term absence. In your opinion, what is the best way to ensure that these employees are receiving the support that they need, whether that's workplace or clinical?
You know, research and experience has shown that Early clinical intervention is the most effective way to support long-term drivers of absence, such as psychological absences. The expected absence increase this year due to the work-related stress people are experiencing, due to people overcompensating at work because their fear of loss of their job security, where there's an ever-changing percent of workforce which have gone on furlough, has resulted in some employees feeling that with the difficulties of dealing with an increased workload has resulted in significant increase in stress in relation to getting ill, getting family members becoming ill, financial problems, anxiety around returning from furlough, on top of the other worries that life continues to present us all with. We speak to employees on the first day of reporting any mental health related absence, which can be depression, anxiety, work-related stress, and panic attacks. Where the business employee belongs to has access to providing a counselling service, we are able to refer them where it is appropriate. Evidence shows that 50% of employees absent for mental health reasons are less likely to return to the workplace after 4 to 5 weeks of being absent from work, whereas 75% are more likely to return to work sooner if seen and treated within the first 2 weeks of commencing their absence.
Thanks, Diane. Next slide, please. So, Andrea, we're due to hear from you now. If you wouldn't mind telling us a little bit more about yourself and also about your organisation.
Thanks very much. So I'm Andrea Stoddart, I'm the HR manager at Exemplar Healthcare, and we are a service that provides specialist nursing care and rehab for adults living with a range of complex and high acuity needs. We have over 30 homes within our portfolio, and we employ approximately 3,100 colleagues. So you can imagine we've got 30 separate locations, 3,100 colleagues, and managing attendance amongst the healthcare sector and across 30 plus locations is a challenge. It's a challenge. And when I came along to the business, we didn't have a service such as Absentia. So we've had it implemented since October 19. And I have to say that when it came in the first instance, it was something different. The managers took quite a time to become engaged, as did the colleagues. It was a whole new service, a whole new change that we had to bring to the business, as well as managing attendance to start with, because we wanted it to be consistent and a process that everybody could easily follow. So that was October 2019. So we're getting it nicely embedded into the business, and then along came the pandemic. So and I have to say that we have a very robust absence management service now within the business. We are able to now have exactly know where our colleagues are absent. We have up to date information of who they are and where they are, and with the pandemic online, we could also track who was reporting to the services with COVID absences, and it really helped us being able to look at the classifications for the absences as well. So whether they had symptoms, whether they had isolating as a family, shielding, all the different classifications that the government could come up with, we were managing to be able to put them in buckets, so to speak. So this being able to know exactly where our colleagues were absent and what they were absent with, really drove supported our workforce planning. So we created bespoke reports with the team at Absentia and myself and our leadership team, so that we could then measure where we could potentially see hotspots of our staffing levels, needing some additional support. So routine testing came on board later on down the line, and that really helped us identify where we may potentially have had outbreaks in the homes. So then we could immediately deploy our outbreak procedures in the homes, and it just gave the managers and the leadership team a sense of we know what we're dealing with here, even though nobody could really predict what they were dealing with the pandemic. But for us, it really gave us that comfort in how to manage our homes and support our service users in their homes. So along with Absentia being in place now, our managers had to get used to this system. We had to get used to it as a HR team and as a business, and it really supported us with our critical staffing. We were able to, as the guys mentioned earlier on, with the absence notifications, we had all of our leadership team and our operations team as part of the absence notification for COVID. So when you could see the notifications popping in, each operations director that responsible for their area of responsibility could see exactly who was going to be absent, and what we had to do to sort of drive our staffing levels. And this also helped us to make sure that we could provide quality of care for our service users. It was a situation that none of us were ever faced with before, so it was quick learning, and it really drove the uptake for the managers to become used to the system, familiar with the reporting. And actually, as people started coming back to work from being absent with COVID, it really supported us in making sure that appropriate return to works were completed. So it drove our compliance rate up with that as well, because that was another issue that we were potentially struggling with engagement with managers. So it allowed us to develop a lot of internal processes that we're still using to this day. And obviously with the peak of the last wave, it was kind of, we've been here before, we know what we're doing. So, it gave us some kind of comfort that we could support the business and support our colleagues at the end of the day as well. And our colleagues have appreciated the callbacks with the triggers for the certain COVID classifications. As far as they can see, the colleagues, it's all all belongs to exemplar. That's how it's set up. So the colleagues do get some support there. We've had additional calls from the team as well when they've become worried about somebody's mental health or some people's comments when they do actually call into the service. We've had that they've gone above and beyond, where they've actually contacted myself or a member of the team to say, we're worried about this call, our call handler's taking this call, and then we can pick the details up and follow that through with our managers and colleagues, and that's really given us some support in that area. So it just gives us a peace of mind that that we know where we're at and what we need to plan for. So again, it's really helped as well. So we had a really significant high absence rate, and we've managed to reduce that absence rate down by 10% since we've had Absentia embedded. And that's because we've also been focusing on our managing attendance policy, which Absentia picked up, used, and made the system fit with our absence management policy. So it's really great that what the call handlers are talking to our colleagues on the end of the phone about reflects our absence management policy as well, and our triggers. So it all kind of seamlessly fits together. So we've pushed the system, and we're growing as a business. So we've now got an actual a really good implementation program as well with our new homes as to come on board. So it's just normal business for us now to use Absentia in partnership with our managers and managing our attendance in the home. It's really engaged, and we can see the difference in the decrease in our absence management. We also have made use of the occupational health services, and there we're really quick turnaround on that. So if our manager pops in a referral for an occupational health assessment, we get a really quick turnaround on some appointments to support our colleagues in returning to work as well. And that has really supported us with our long-term sick colleagues as well as we've gone along and got used to the system. So I'm just looking forward to what's next with Absentia, really. We need to crack the stage management piece with our managers and our business, but it's a work in progress, and it's good to be part of using this product. We've actually had lots of calls with Chantel and the team, and they're always looking for our ideas to support the system, and it's a two-way relationship really. And all I can say is that it's first absence management service I've used, and I do feel like I've contributed to part of the development as well, and part of bringing Exemplar on in the world of absence management. So yeah, thanks guys.
And congratulations, Andrew, on your reduction, because that was only been possible because you guys have been working so hard using the service and the system. So well done to you.
Yeah, that was a good day. We did a little dance that day, and then I'm not going to lie, the pandemic hit and it shot straight back up again. But we've had our figures in today actually for the end of our financial year, and yeah, I've got a big smile on my face today. So
congratulations.
Yeah, it's helped. Thanks a lot.
Amazing. Thank you so much for sharing that with everyone.
No problem.
Next slide, please. So, Andrew, you touched upon some important points there, that your managers had to get used to the service. Obviously, it's a bit of a shift in culture, a shift in attitude toward managing absence as well, as opposed to sometimes texting in, anything like that, creating this robust process. And the culture around absence can vary dramatically in each organisation, and with COVID adding new pressures to that, there was certainly uncertainty around job security, and businesses saw a rise in presenteeism and burnout in their employees at that time. Many individuals at the time would have had an increased workload, but equally didn't want to refuse this work, as there were some anxieties around that, due to some of their colleagues being on furlough at the time. They would have definitely felt that their workload increased, and that creates a lot of work-related anxiety, work-related stress. I'm sure I won't be alone in saying that on LinkedIn I saw a flock of people that were saying how grateful they were to be in their jobs, but equally looking for employment at the other end of the spectrum. And perhaps maybe a mix of both fear and gratitude would have meant that a lot of potential absences at that time over the last year would have been worked through, and didn't receive either the time off that they needed, the clinical support, or the support from their workplace. Now, whether managing absence internally or through a service, what are some of the best practices for organisations wanting to create a good workplace culture around absence?
So some of the things that I'm going to just run through now, we obviously go through these with our clients as part of the implementation and ongoing reviews of what we're doing with them. But these sorts of things are things that every business should be doing as part of managing absence, not even just COVID absence, absence in general. So the first thing and the most basic thing is you need to have a clear absence reporting process. It needs to be fair and consistent. So it doesn't matter who the employee is, who their manager is, where they work within the organisation. Everybody should be going through exactly the same absence reporting process. To then back that up, you should have a clear absence policy. So actually, whatever you're dictating should happen within your absence process, it's reflected within your policy, so that if people aren't following that process, there's clear repercussions of what a manager should be doing to manage that. There needs to be clear triggers in place so that if somebody is having a certain level of absence, a manager knows what they need to be doing at that point in time. We also need to be having clear support and communication for employees. So regardless of the absence length, we would always encourage managers to stay in contact regularly with their employees. It's important to make sure not to be chasing them to find out when they're coming back to work, but to check in with them, to check they're okay, to see if there's any support that they're requiring at that time. We've talked a lot today about early clinical sorry, that's my iPhone. We talked a lot today about early clinical intervention, and it really is important for day one absence management, because we want to understand if there's anything we can be doing to support that individual, rather than leaving them off for a period of weeks at a time, where actually it becomes a much more complex case to try and intervene and support them. So communication is key to understanding that information. Also, if it is appropriate that they get some sort of support, making sure that you're referring into the appropriate services, so counselling, physio, occupational health, so making sure managers know that that support's available for them. And finally, the return to work interview for when somebody comes back off absence, back to work, regardless if they are having a day of absence or a week of absence. It's really important that the manager takes that time to not have a tick box exercise to say, yep, done it, but more to have a informed conversation with that person, to ask relevant questions, to see if there's any support that that person actually needs, to then potentially prevent them from going off work again with the same absence reason. Now, all of this is great, but you need to empower your managers. You need to make your managers realise that it's their responsibility to actually be managing absence. And actually, it's their responsibility to look after their team. So it means that sometimes you need to have an educational piece with them, because actually someone might be promoted to a managerial role because they're really good at their job, but that doesn't automatically mean that they're good at managing people. Or they might have had an awesome team who've never had any absence. So when somebody's off with that work-related stress, it's a huge problem for them. It's worrying, it's, you know, it's scary that actually they don't know the right questions to ask. So it is really important to support managers to make sure that we are supporting them. They understand the process, they understand the policy, and they understand that they can ask for help in those situations when they are a bit worried because they haven't come across something before. Because unfortunately, absence isn't just black and white. There's a lot of grey areas that we have to tackle. And my final point is that we need to monitor absence data. So we talked earlier on about monitoring COVID absence, because obviously we want to be making sure in terms of infection spread that that's not happening, or, you know, reacting to that. But actually, we should always be monitoring absence. We should always be looking at our absence levels, if there's a particular team, division that's actually driving your absence, because actually maybe there is something that we need to do in terms of training to support people there. Or is there a particular absence reason that's creeping up in a certain area? Because what you can then do is, by identifying that, you can then speak to your occupational health team and look to see what else you can be doing to try and not just reacting when people go off work sick to say, oh, how will we support this person? Actually trying to proactively look to see, can we do something here to prevent other people from going off with the same absence reason? So not just the reacting side, but also proactively looking at that. And that's how you'll manage absence across the organisation. And when you then start to manage absence, as we've just been highlighted by Andrea, that's how you'll get your absence reduction.
That's really great. Thank you, Chantal. Next slide, please. So that actually takes us to the end of our side of the webinar. If you would like to hear any more about managing absence or any more detail on that at all, please feel free to take my contact details on the screen, but we'll move on to some of the questions now. Okay. So we have a question here. I won't say any names. Where can we get more information on stress risk assessments?
I'll answer that for you. The stress risk assessments are available on the HSE website. And if you search the website against risk assessment, stress risk assessment, the website will guide you to the assessments. Can I just advise, it is really good support to do the risk assessment in conjunction with the affected employee, and you have their input into that risk assessment.
Thank you. We have a question here around how has your organisation managed long COVID, or I imagine how we're going to manage long COVID, because that's something quite new going forward.
I'm not clear who the question is for.
Diane?
Long COVID is a new developing, or better understood, still learning to understand the dimensions of long COVID. At this point in time, there is the development taking place for what they're referring to as long COVID clinics. These are available in some of the larger centre NHS hospitals. My advice is to follow that on the internet in terms of where these services are available. I think that will help to answer your question.
Here at Exemplar, we've devised a long COVID guidance for our managers, and the NHS have an excellent website, and they have lots of information on there where they can signpost managers and colleagues with long COVID for mental health support, rehab, and just give you some really good ideas on how to support your colleagues to return to work when they are eventually able to return to work. We rolled that out a couple of weeks ago in our business, just for support, and that seems to have helped helped our managers to understand long COVID a bit better, because we don't know much about it just yet.
Yeah, we don't.
There's a question that said, will the slides and a recording of the session be made available? Yes, they will. We'll be sending these out shortly to you, so you can have them for your own viewing or for colleagues following the webinar as well. And one for Andrea. So Andrea, we've heard a lot about how COVID has been managed within your organisation. What about other absences?
So yeah, it gave us a great opportunity of just managing other absences exactly the same as we managed COVID absences, to be fair. You know, it's, yes, you know, COVID is, you know, has been the main absence which is overtaken, but yeah, we still have other absences, and it's really great because the process is the process, regardless of the absence. You know, I don't mean to be, you know, flippant, but you know, so it's really helped embed just managing the whole absence management, along with we record where people cannot make it to work because of childcare arrangements. That's really helped us to focus our area on how we can support some of our colleagues with their childcare arrangements, you know, how we can look at their shift allocations, you know, how we can make sure that people can come to work and feel supported regardless of what their absence is.
Brilliant, thank you. There is another question. I guess this one's open to everyone to answer, really. So I find quite a lot of staff don't like to be contacted when they first go off sick, especially when they have provided a medical certificate. No amount of research saying why early intervention and contact is important can persuade some people back to the workplace, that you are not being intrusive or heavy-handed by getting in touch. What advice can you give in dealing with this type of situation? It's a great question.
I don't mind answering this one. So I think that this comes back to what we were talking about with the manager training piece, because it is about how you have those types of conversations. If you're phoning up someone to say, when are you coming back to work? It's quite a different type of conversation to be able to say to someone, I'm just phoning you to see how you're doing, to see how you're checking in. And so by changing the tone of that conversation, that's how you can empower managers to feel comfortable about having those types of conversations. So again, it comes back to identifying the needs of your managers. And I know that when we've done manager training sessions, which Andrew will know, we've done them to death for your organisation, because every time a new home's come on, we've done some training to make sure managers not only know how to use the service and the system, but also, you know, we can try and help support with some difficult conversations. And if managers identify that they need further training, then we can obviously work with the HR team to try and raise that. And the other thing that you can do in line with your policy, with your absence policy, it's important to have within that agreed, if it's an ongoing absence, agreed times when you'll actually be contacting that individual. So having that within your absence policy also helps to make sure it's clear for the manager when they can be contacting that person too.
Thank you. And then we've had one, is Absentia portal, how much does it cost and what is the contract term? So I'm happy to answer that. So we have a system called Medigold One. A lot of you here will be with us for our occupational health. So in the same way you have your Medigold One portal, we have that for Absentia as well, for managers to go in and have visibility over absences and manage those absences as well. So they'll see any return to works that are pending, they'll stage management accesses from that as well. In terms of cost and contract term, obviously that's different contract terms for each client, but we can discuss any costs off of the webinar with you. And would you provide absence management training if we don't use your portal?
I think that's something we can certainly support with. If we want to have pick up after this session what exactly you need. I think at the end of the day, everybody needs help in managing absence. Obviously, we've talked a bit today about our service and our system, but we do know good practice in terms of a good policy, in terms of good return to works, in terms of what we expect from managers and managers' responsibilities. So we can certainly help assist with those types of things. So perhaps we'll speak separately after this session and see what your requirements are and see what we can do to help with that. Absolutely.
A lot of what you touched on your last slide are the best practices, and some of those can be taken with or without the service.
Yeah.
There is another one here. Staff members do not wish to take us up on EAP counselling, RE, anxiety and stress. Plus HR have tried to engage over the phone, and he has said our HR are stressing him out. So that's a particular situation that's going on for an anonymous attendee. I imagine the question is, what would we do in that situation? What type of advice would we give?
Yeah, I would advise that, you know, we respect people's wishes, and, you know, tread with compassion as you would with anybody that you would speak to, but also, you know, it's kind of a two-way process, that, you know, we need to support our colleagues, and I guess we just would give them time and discuss with them how they would like to be contacted, agree sometimes without causing too much stress, and just, I guess it's just gently coaxing them to, you know, provide as much support information as you can to them, directing them to their GP for some support, directing them to any EAP or any other services that are out there that you can find on the web.
Absolutely. And that also brings us back to the point where the manager's also welcome to get in contact with the employee if they had a better relationship and they felt that they were more willing to open up to their manager. Sometimes HR can be a bit of a foreign entity within a business. So yeah. Sorry, Andrea.
Yeah.
Right, that's all of our questions. All I can say is thank you so much for listening today. And if you do have any further questions or would like to find out more, please do get in touch. And thank you to everyone that's joined us on the panel. Thank you, Andrea, for joining us today.
Thank you for the invite. It's been good. Cheers.
Thanks, everyone.
Thanks.
Thank
Bye.
you. Bye.
Bye.